Hi, it's Liz Cunningham here again from Making Our Seniors Matter, and we're talking with Tom Vincent. Where did the dream come from and how did it start?
Well, it's interesting, a little bit anecdotal, and a little bit to do with my own family, but I have been in the hospitality business all my life. So I really understand how to serve people, and I treat people as guests all my life, or I have. So putting this together, I really understood what people wanted. But having gone through the process of bringing my parents up from Toronto, buying them a house here, selling their house there, going through the issues of the hospital and the things that they needed as they were getting older as far as services. It is, I mean, because everybody is so different, obviously.
Right.
And it was a big challenge both for my mom and my dad. So anyhow, I had this vision of an adult lifestyle village. I did a lot of research in the United States, which I think are far ahead of us, you know, in a lot of ways. And I did a lot of research out in Vancouver. Okay. And I found that we were underserved here in Ontario. And a lot of the properties that, you know, people would move into were more institutional, shall I say. Rather than looking at a project like Balmoral, which from my perspective, if we can keep people active, and we can keep them healthier, they're going to live longer. And that's what we all want to do, but we also want to do it on our own terms. And I think that, you know, as I talked to one of our customers the other day, you know, they said, you know, we actually, sorry if I go back and say, you know, we've sold 96 of our bungalows in towns, we're sold out. And why are we sold out and why do we do it in record time? Was the standpoint of people could buy outside and buy any type of property that they wanted on a freehold basis. People bought here because of the vision and because of the location.
It fits what they need, right?
They know that they're going to need help in another 5 or 10 or 15 or 20 years. And these people are forward thinkers. They're planning on what their needs may be in the future. So if it works for them, this is a perfect spot for them.
Yeah. You've provided them a social space for them to be well and be healthy and be active all in one area.
Absolutely.
They get out of it and they don't. I think a lot of times some of our older adults think back on when they were young, they didn't even think about getting older, and then as we get older we have the fear factor of thinking somebody's going to lock us away somewhere in a long-term care facility and with a lock and a key and you'll never get out, and you have to ask for permission to leave, and that's very scary. So when you talk about a place to go, what you've provided here is really their dream too.
And I think that there'll be a lot of behavioral contagion because of the activities and things that we have planned here, so that people will really, you know, enjoy the activities, will want to come out, people will encourage them to come out, and they will actually, after the first 6 months to a year, will be actually planning their own activities, and we're looking at that and how we're going to function that, because here we have a recreation clubhouse and we have 8,000 square feet.
Wow, that's big.
And we have a swimming pool, we have a pub, not together by the way.
No drinking and swimming at the same time. No. Thank you.
And we also have, you know, a great place for exercising, state-of-the-art, quiet rooms, library, pool table, all of those things that people will really enjoy, and they'll congregate and they'll meet, and they'll plan their own programs, you know, as we expand the village. Yeah.
One of the biggest problems in our communities and societies at the moment is isolation for seniors. When you become isolated, you stop living, kind of. You don't have somebody to talk to, share your issues with, have fun with, have a laugh with, have a drink with. And so you climb inward. And so providing something like this brings out that person to meet with other like-minded people, and hopefully they don't stay hidden in their homes anymore, but they get out.
No, that's a very good point, and the people that are buying in here are buying because of the philosophy of the adult lifestyle village, and it's an adult over 55 community. So, and we call it an age-in-place community. And why is it an age-in-place community? Is because you can go from a bungalow to a townhouse to a condominium to a rental apartment into the retirement residence and never have to leave the property. Again, when I talked about bringing my parents up from Toronto, after 64 years, they had to leave everything behind. And it was a shock for them to do that. They just loved Collingwood. But here, you know, it's just, they don't have to leave. You can buy in at, you know, over 55 and for a variety of reasons, and the 5 different types of housing, and cater to what your needs are going to be from now and into the future.
you. Aging in place is important, and it's a term used a lot. I hear it at hospitals, I hear it government, different levels of government, I hear it in senior groups as they meet together, and yet they don't all have the same vision of what age in place is. For some people it's, I'm going to stay where I am, I'm going to age in place here until I die. Bring the box, because I'm not leaving. And for others it's your vision, it's staying in place and aging here, but not leaving this community to die. And that's what's sad, when people have to leave their community and leave everything behind them. That's what where they miss the whole, how this concept meets the aging in place, as I see it, and obviously as you see it, as the most ideal way to plan that part of your life.
Absolutely. I mean, you've hit on everything as far as aging in place is concerned. You've hit on all of the salient points. And it really is having the ability to stay in one place and then take on, you know, in this medical wellness center that we have planned here for 25 to 30,000 square feet, we'll have doctors, physiotherapy, massage therapy, audiology, optometry. We'll have all of these services there, and we're putting in also a medical concierge, which is the first time that anybody's done this in Ontario, to my knowledge. And so that medical concierge will be able to look after all of your appointments. There's a small fee involved, but be able to look after your appointments. We'll arrange transportation. But the most important thing of this is the interpretation of the appointments, and then follow up on from a medical standpoint of what what drugs you may need, yes. And then contact you once a month and talk to you about how you're doing and are you taking your drugs properly, etc., etc. Because 60 to 70% of mature people stop taking their medicine after 6 to 8 months, and this affects our whole medical system.
Absolutely.
I don't want to sound too altruistic, but I think that again, having this medical concierge in place is a great benefit, and we're going to not only offer this to the residents of Balmoral, we'll be offering it to all of the citizens of Collingwood.
That's fantastic.
But it'd be a better price here, of course.
It'd be nice here. You should stay here, be close. One of the things that medication brings up immediately to my mind is Alzheimer's and other illnesses that bring people to hospitals and have medication and doctors. And what they're discovering is that there are so many medications that may actually affect Alzheimer's in a negative way and have symptoms come up that shouldn't be there. And it's the combination of medications, it's the number of medications, it's whether they're taken regularly or not, and who's overseeing that whole thing. And you've just answered how that can happen safely for somebody who lives here and is able to go to your clinic and get that one person who knows all of the pieces, instead of little silos here and there of medical care, and we're not talking to each other about our individual patient.
And the other thing which is extremely important in regard to Collingwood is that we are the first municipality that has put in electronic messaging for all of our doctors, which is coordinated with the hospital. So the doctors and i.e. the medical concierge and the people who are looking after that program will have access to your records. And as soon as you go in there, it notifies the doctor that you're talking to them about something. And so we're the first municipality ever that's done this. So you're coming to a community, and not only Balmoral Village, but Collingwood also, that has a very unique health lifestyle that is going to help you with your health as you mature.
So we need to be forward thinking, planning ahead, and knowing what's out there, and that's part of why we're here today, is find out what you're offering here in Collingwood.
Absolutely.
Thank you.